Hi, my name is Christopher Jobeck. I'm a physical therapist. I want to talk to you today about reducing the risk of ACL injuries. Unfortunately, ACL injuries are on the rise. Female athletes are 6 to 10 times more likely to suffer an ACL injury versus their male counterpart. We want to give you some pointers of things to look for in order to help reduce the risk of an ACL injury in your athlete. So Casey's going to help us to demonstrate some of the improper biomechanics you might see, and then we're going to correct those, show the proper biomechanics. So as a coach and athlete and as a parent, you really want to pay attention to her form, her activities, and we'll point some of the things out that you want to observe. So I'm going to have Casey go up, and I'm going to have her jump. Now what she's going to demonstrate on this one is the improper mechanics that you will often see. Okay. So we saw a couple of things with her jump. First of all, very hard landing, not a whole lot of knee flexion. Her knees tended to come in, that internal rotation, which adds an increased torque force to the ACL. The ankle collapsed in, hips didn't flex. So all those things make for a very firm landing. And the problem with a very firm landing is the ACL takes all the stress because the muscles cannot act dynamically in order to help protect that leg. So we want to make sure that we do a couple things to correct those mechanics, which Casey's going to show you now. So as she's going to go land, what we want to see is a high amount of knee flexion, and we want to see a nice soft landing. Okay, so what we saw there, a couple really good things. When she came down, a lot of knee flexion, really brought him down, activates the hamstrings to protect the ACL. The knees stayed straight ahead, the ankles were nice and soft, the feet didn't collapse, and then that allowed her to spring up at a better rate and more safely. So all those things are what you want to look for with your children, your students, your athletes. You want to make sure when they're jumping, whether it's volleyball, basketball, that they have those proper mechanics to reduce that risk of an ACL injury. Now, as we talked about earlier, we'll also see the same thing with cutting mechanics. So what we're going to have Casey do is go from the right and perform a little bit of a cut, just as you would in any sport where you're going to change directions. So she's going to come forward to the left. We're going to see a change of direction. And what we want to look for with that one is we want to make sure that she's shifting her body weight over. What we don't want to see is a cut where the leg's out here and the body weight's over here. We want to shift that body weight over. The hamstring will flex a little bit more. We get a little bit more spring, a little bit more protection of the ACL. When we're all the way out here, the knee's extended. We don't have any availability of the hamstrings to protect the ACL. More likely to turn, and again, that torque force is what increases the risk of injury to the ACLs. So again, as you're watching your athletes, pay close attention. Give them reinforcement. The more you can reinforce these during practice and non-game times, you're going to get that carryover. It takes about 10,000 repetitions to engram a motor pattern. So we need parents, we need coaches, we need the other students to help each other make sure that we reduce the risk of ACL injuries. We're going to start with a couple exercises for Casey. The exercises are going to be important for a couple of reasons. One, we're going to get some strengthening of the appropriate muscles that help to protect the ACL. We're going to start with a lunging exercise. So we're going to have Casey do a start from feet being together. She's going to bring one leg out forward. Ideally, we want to get about close to your body height. So Casey's about 5'6". We're going to get her to go out about 5'6" out. So she wants to take a nice long lunge. And as she's taking that lunge, she has to focus on controlling the one hip for balance while the other leg comes out forward. So when you're ready, Casey, I'll have you take a nice lunge. So she comes out with a long lunge. What we're looking for is her knee is staying right over the third toe. The knee isn't coming over past the ankle. The trunk is in a nice, good upright position. She's got lengthening of the hip on the opposite side. Once she has this, now return motion, she's going to put a good force through the lead foot. Halfway through, she's going to transition, and the rear leg is going to use the gluteal muscles, the rear end muscles, to help pull her back up into the stance position. And as you can see, it's a very tough exercise. It works both hips, but it's incorporating some single leg activities, which are going to be very, very important for your athletes. We'll often get stuck on doing things with two legs, whether it's squats or deadlifts. However, it's very, very important to work on that single leg. Most ACL injuries, when they occur, is when someone's on one leg and they lose rotational control, which often will come back up to the hip muscles. So the first exercise we're going to start with is a single leg hip pike exercise. Focus this one is a combination of control of the gluteus medius, which will protect the lateral hip, prevent that internal rotation, and some quadricep combined with balance. So I'm going to have Casey step up. We have about a 5-inch step. She's going to go single leg. What she's going to do is she's going to hike the opposite hip up, which is going to activate the gluteus medius on the stance leg, and then she's going to lower it down. Nice good control, and then a nice big push back up. So the key with this one, she's going to come up. All the motion is coming from the stance leg, lifting back up. Good hold, 3 to 5 seconds. Good control. 2 sets, 10 repetitions in order to build up that dynamic stability, a little bit of balance with the hip. Next thing we're going to work on is a proper squat with an overhead reach. Really challenges the mechanics of the system, flexibility, mobility. So we're going to have Casey start with is raising the bar up overhead. At home, you can use a broomstick. If you play any sports, a lacrosse stick, field hockey stick, anything where you can just kind of grab hold, start above, that's going to get a little of the mid-spine into a good position of extension. Then we're going to have Casey do is evenly squat down as far as she can. Careful attention again paid to the knees, staying over the third toe and not letting any of that internal rotation or that collapse. You want to come down as far as you feel comfortable as long as you keep proper mechanics. Again, the mechanics are more important than how far you go down. So when Casey's ready, I'm going to have her go down into her squat position. Okay, you can see she's going to keep nice upright positioning there, really tough for balance. And again, when you have that landing mechanism, this is something you need to work on because you've got to get that motion back down. Okay, so we're going to practice again. Good control, perfect. Nice, good upright, eyes are up, knees stayed right over the third toe, no collapse in. That's what we want to see out of a good squat. Don't practice a squat with any weight until you can do this unloaded squat, the correct mechanism. Good control, good force, come down nice and even. The next exercise we're going to do is very good to activate the gluteal muscles, release a little bit of the hip flexors. Great warm-up exercise to do without weight, or you can also add weight if you want to make it a little bit more of a strengthening. So we're going to do a bridge. The key when we do a bridge is we want to get lots of gluteal muscles, not a lot of hamstrings. So we're going to set up our bridge with 5 steps. First step she's going to do is push her hands into the table. When she pushes in, she's going to activate a little bit of the core. Second thing is she's going to lift her toes up. Toes up creates what we call an extensor moment. All the extensor muscles of the lower extremity work. When she can turn on the quadriceps, which are a knee extender, the gluteal muscles, which are hip extenders, she helps to turn off the hamstrings. Third thing she's going to do, she's just going to push her knees out lightly. Fourth thing is she's going to squeeze the rear end together as tight as she can go. And the fifth thing, she's going to elevate the buttocks up off the table, trying to keep the hamstrings nice and relaxed. Glutes are doing all the work. Hip flexors get released, and then a nice slow lowering motion back down. The key when you perform this is you want to do those 5 steps each time you perform. You want to make sure that we minimize hamstrings, really get quads and glutes, turn off the hip flexors up front. Typically a warm-up with these is about 10 repetitions. And you can perform this, if you're on the field, you can perform right on the ground. If you're at home, you can do it on a firm surface. You can perform it on a bed, which is a little bit more challenging because it's softer and everything will shift a little bit more. But one of those things for me, if you're on the field and playing, something you can do right on the ground. Next exercise we're going to have Casey perform is what we call a clamshell exercise. The goal of the clamshell is to isolate the gluteus maximus and the posterior fibers of the gluteus medius. But more importantly, it's teaching the hip to move independently of the pelvis. So she's going to start sideline position, knees are at a 90-degree angle, hips about 45, feet are together. She's going to keep the feet together. She wants to keep everything at the pelvis and the low back perfectly still. So she's going to elevate the top knee so she's rotating only at the hip joint. I want to make sure nothing is moving behind her, and then a nice slow lower back down. The key with this one is the way down is always slower than the way up. You want to get that good, what we call an eccentric control, really gets those posterior fibers of that gluteus medius working very well, again, to control some of that internal rotation to make sure we avoid that valgus stress at the knee that's responsible for ACL injuries. So up, nice and easy on the way down, nice and slow. And you might notice a little what she had there, sometimes that muscle ratchets a little bit, and anytime that muscle doesn't work quite as efficiently as it should, that'll go a little ratcheting motion. As you get more proficient at completing these activities, that will become much more fluid. I'd just like to thank Casey for helping us demonstrate the different exercises and the proper and improper biomechanics with landing. The key with these exercises, and as we talked about earlier in the talk, everything comes down to all the activities, lots of reinforcement from parents, coaches, and your fellow athletes. The more you can help each other, make sure your mechanics are correct, multifactorial, build up your strength, your flexibility, your mobility, But really what makes the biggest difference is the whole team working together to help make sure that we can reduce the risk of ACL injuries.